Okay, this lesson is going to cover lymphoma. Now, this is very similar to leukemia in that they're both cancers affecting the white blood cells, but we want to help you differentiate and break down the difference between the two. So, where leukemia is a cancer of the bone marrow affecting all white blood cells, lymphoma is a cancer of the lymphatic system, and it primarily affects the lymphocytes only. Now, remember that the purpose of the lymphatic system is to participate in our immune system. These green nodes and vessels that you see throughout the body, these are our lymph nodes, and that is our lymphatic system, and it helps circulate white blood cells around the body, especially for any kind of immune response that we need to fight infections or clean up any dead cells. So it helps bring toxins and waste products to the liver or to the spleen for processing. So it's basically the cleanup crew of our body. So when our lymphatic system is affected and it's cancerous, it no longer functions properly. Therefore, our immune response is severely impaired. Now, there are many, many types, but they fit into two umbrella categories. They are either Hodgkin's or they're not. So Hodgkin's lymphoma or non-Hodgkin's type lymphomas. The way that we tell is that they will look under a microscope and see if they see a type of cells called Reed-Sternberg cells. If they see Reed-Sternberg cells, that is Hodgkin's type lymphoma. If they don't, then it's non-Hodgkin's type lymphoma, okay? So just know that Hodgkin's lymphoma is actually a little bit more treatable and tends to be a little bit less severe at diagnosis than a non-Hodgkin's type lymphoma. So tumors are going to form in and around the lymph nodes. And this is a good example here of a tumor that has formed around a lymph node. So you can already see how not only is there going to be an issue with function, but you may even be able to feel this growth on some of those more superficial lymph nodes. Also, remember that the lymphatic system travels throughout the body. So these cancer cells can also travel through the lymphatic system to anywhere in the body, or they just exist potentially within the lymphatic circulation. So to diagnose lymphoma, we have to take a biopsy of the lymph nodes. Usually they'll choose like the swollen one plus one on either side of that. So if this is our lymph circulation, and I've got a swollen lymph node here, then I'll take a biopsy of that one as well as this lymph node and this lymph node so that we can get a comparison, see if anything's spreading. Just make sure after a biopsy that you hold pressure and watch for bleeding because it is a needle. So like I said, one of the primary things you'll see is actually enlargement of the lymph nodes. Now, this could be because of a tumor, but also because of just overproduction of those abnormal lymphocytes. In fact, fun fact, the supraclavicular lymph nodes, which actually aren't even shown here, are the most common ones to get inflamed. And if you have enlargement of the supraclavicular, so over the clavicle, if they are enlarged, it's almost always indicative of some sort of malignancy. You may also see enlargement of the liver or the spleen because that's where all these built up waste products are going to try to be removed. Now, because of the effect on the immune system, patients are at risk for infection, so we want to protect them, implement infection precautions. They also are going to present with just flu-like symptoms, fever, night sweats, persistent fatigue, possibly even shortness of breath, as well as unexplained weight loss. Again, these are kind of non-specific, so it's really important that we do a thorough assessment so we can connect the dots between these general malaise-like symptoms and your enlarged lymph nodes, liver, or spleen. Again, if you see these general symptoms plus anemia and easy bruising, you're probably looking more towards leukemia. If you see these generalized symptoms plus enlarged lymph nodes, you might be leaning closer to lymphoma. Now, managing lymphoma is pretty similar to leukemia. We'll do chemotherapy, we'll do radiation, We could also remove the lymph nodes, especially if there's large tumors. But the other thing we need to keep in mind with lymphoma is its high likelihood for metastasis. Now, metastasis is when cancerous cells spread to another place in the body and create new tumors. Remember, the lymphatic system circulates through the whole body, so they have a high risk of moving and traveling and then setting up shop in other organs. So these are the most common sites that we see for metastatic lymphoma and for tumors to form other places in the body. So it's important that we monitor for any signs that these organs may be affected as well. So priority nursing concepts for a patient with lymphoma are going to be infection control, clotting, and cellular regulation. We want to prevent infection. We want to use strict hand hygiene. They may also have anemia or have other blood cells affected, so they can bleed from their biopsy site. They can bleed from IV sites, so we need to monitor that as well. And we want to support them through their chemotherapy treatments, monitor for any signs of metastatic disease. Now, in the Oncology Important Points lesson, we're going to talk a little bit more in detail about caring for a patient who's getting chemotherapy. Also, make sure you check out the care plan attached to this lesson to see more detailed nursing interventions for a patient with lymphoma. So let's review. Lymphoma is a cancer of the lymphatic system, specifically affecting the lymphocyte type white blood cells. It's either Hodgkin's or non-Hodgkin's based on the presence or absence of Reed-Sternberg cells. Usually presents with flu-like symptoms plus enlargement of the lymph nodes, or possibly even the spleen or liver. Now, lymphoma has a high metastatic risk because it can easily travel throughout the lymphatic system to the rest of the body. And remember that patients are at a high risk for infection because of their compromised immune system. So we want to use good hand hygiene and implement infection control precautions for these patients. So those are the basics of lymphoma. Don't miss all the resources attached to this lesson to get a big picture of how to care for these patients. Okay, guys, with that said, go out and be your best selves today. And as always, happy nursing.